My name's Mark Biska. I'm a general acute care and trauma surgeon here at Muskegon Surgical Associates. So here at MSA, we are able to do colonoscopies as well as EGDs here in the office. That prevents people from having to go to the hospital and do it in a nice, intimate, smaller setting that is much more comfortable for patients. Colon cancer is a very common cancer in our society, and with colonoscopies, we're able to find it when it's at a precancerous stage or at a very early cancer stage that can be easily treated non-invasively. The new recommendations are 45 years of age when we start screening colonoscopies. And then we also do what are called diagnostic colonoscopies. So if someone's having rectal bleeding or chronic abdominal pain or chronic constipation, chronic diarrhea, things like that, we'll actually do a colonoscopy before age 45 in order to see if there's any abnormalities that we can fix and get you feeling better. The day before you get your colonoscopy, we have to clean your colon out in order to see on the inside to find any of those small abnormalities. And so that's what we call the colon prep, which is typically the most uncomfortable part of getting a colonoscopy. The colonoscopy itself, you don't really remember because we make you sleepy for it, but the prep is usually the thing that people remember and they don't want to experience again. The nice thing in this day and age, we have multiple different options that we actually tailor to individual patients for their prep. You know, there's some bigger preps where you have to drink, more than a gallon worth of fluid, and there's other smaller preps that we can do where you just have to take a few pills and drink a few glasses of water. That whole day though, prior to the colonoscopy, you will just be on a clear liquid diet. And that's to help flush your system out. And then that very next day, you come in for the colonoscopy. The colonoscopy itself takes about 20 to 30 minutes. Here in the office, you'll be here for probably about 2 hours. And that's time before the colonoscopy to get you all set and ready, meeting the nurses and all of those people, and then time afterwards to wake up and be ready to go home. The most exciting thing for most people is waking up and realizing that they get to go and have a cheeseburger and fill their stomach back up. So the recovery from your colonoscopy is pretty simple. The day of the colonoscopy, you may have a little abdominal discomfort, some bloating, some excess gas, but it's pretty well tolerated. You'll be able to eat regular food that day. If we do take biopsies or have found any concerning abnormalities within your colon, we'll give you a call or send you a letter with the results of those. Depending on the results, it may just be a letter saying, hey, we're gonna do another colonoscopy in 10 years, and it may be a call from our nurse saying, hey, we found something concerning, the surgeon wants to see you in the office. But we'll keep you apprised of every step, and you'll never be left in the dark. So if you're someone at the age of 45 or even older that need a colonoscopy and haven't had one or have had one in the past and want to have your work done here at MSA, you just call our office. We have a specialized navigator that helps people through the process of getting their colonoscopies done, and she's happy to work with you in any way, shape, and form to get you scheduled.